One of the questions I get in particular from my transgender patients is what's the difference between a breast augmentation for a cisgender woman versus a transgender woman? This mostly has to deal with the baseline anatomy that you're starting out with. Most cisgender women who are coming in for a breast augmentation already have some degree of existing breast tissue. Also, the nipple areolar complexes tend to be a little bit more centered on the breast and closer towards the middle of the chest. When we're looking at transgender patients who have more of a masculine anatomy at top, a lot of times they have smaller nipple areolar complexes. The nipples are closer to the inframammary fold or the crease of the chest. And then they're also set out a little bit farther apart. So they sit out a little bit farther on the chest. So when dealing with this, it's really important to tailor the breast augmentation to make the most natural looking breast possible. So for cisgender women, there are a couple options. The incision can be made around the areola, it can be done underneath, and the implant can be placed above or below the muscle. For the most part, for transgender patients, this is the same. I do find it a lot more difficult to actually put implants around the areola for transgender patients, mostly because starting out, the areolas do tend to be smaller, and a lot of these patients need to have a little bit more volume to compensate for the lack of existing breast tissue. So you're trying to fit a larger implant into a smaller incision. So usually those patients, I prefer to put the incision at the crease or below the crease.